Thank you so much for having me. Bye.
So let us wait for a while so that some more children should join.
How are you doing, ma'am? Thank you so much for
Yeah,
this.
yeah. Rather, I'm excited that you have accepted my invite, right?
But I'm sorry it was a little late. I'm in the middle of my rotation, so sometimes I'm on 24. It
Not an
becomes a
issue.
little difficult.
Not an issue. Not an issue, Aditi. You must have uh, maybe postponed some of your engagements, I believe.
No, today was an off. Today there is Thanksgiving weekend, so it was
Okay,
an
okay,
off.
okay.
So I was,
Thanksgiving. Okay. That's good.
yeah. How are we doing? Is everybody able to come in? Is there any trouble for anyone?
No trouble. They all are coming. They all are coming. Deepika? Deepika?
Yes, ma'am.
Yeah. Ask everyone to join fast so that we
Yes,
start.
ma'am.
There's no rush. It's okay.
Daddy has not joined.
I think he has.
Okay. He has joined.
I think he. I think so. I think he has.
Okay. So, how many participants have joined? Let me see.
I think they're 22. That's a good number.
Yeah. So, maybe from the art stream, rest of the stream, I believe they will join within 2, 3, 4 minutes.
Mm-hmm.
So, Aditi, I would like to listen to your experiences of the school days too. Yeah.
I should have put some pictures. I didn't put any big pictures, so I'm sorry about that.
No, no, not an issue. You can
I
just.
I have good experience in school. I think if I had a choice, I would still go back to Kendra Vidyalaya again. We were a very good friends,
Okay.
and I was there from my third standard to my 12th standard.
Okay.
So that was, I think, a very टाइम एंड जब आर्मी नेवी एयरफोर्स के स्टूडेंट्स होते थे ना
Right.
तो सबके पेरेंट्स शिफ्ट होते थे हर साल और मेरे केस में मेरे पापा वहीं पे थे वो एक बार शिफ्ट हुए थे शायद नासिक पर वापस आ गए थे मुंबई तो
Okay.
मेरे साथ होता ही था कि थर्ड चले गए वो वापस आ जाते थे 8th स्टैंडर्ड में
Okay.
तो मतलब बहुत आते जाते रहे हैं बहुत सारे और पहले समझता नहीं था ऐसे व्हाट्सएप वगैरह नहीं था तो लोगों के साथ कांटेक्ट नहीं रहते थे तो बहुत सारे दोस्त बन गए और फिर वापस वो निकल जाते थे फिर नए आ जाते थे
Okay.
पर बहुत अच्छा एक्सपीरियंस था मेरा मतलब बहुत ही अच्छा एक्सपीरियंस हमारे फ्रेंड्स बहुत अच्छे थे भी मेरे को आई लेफ्ट इन 2009
Okay. So
I'm old but not too old now.
you miss those days. Do you miss those days?
Oh yeah, absolutely. मतलब सबके लिए ये कहना बहुत जरूरी है कि I think you are at the best days in your life right now. जब आप
School time is the
to
best
start thinking
time.
about
Uh,
हाँ
School time is the best time, right?
टाइम होता है ये सब करके तो मम्मी डब्बा बना देती है कपड़े धोके देती है, कपड़े अपने सारे चीजें में रखे रहता है, तो साफ करके रख के रखता है,
No
बना
responsibilities.
रहता है।
मेरा अच्छा हो गया।
मतलब कोई रेंट का कोई टेंशन नहीं है काम क्या होगा, मंथली पेमेंट क्या होगी। और अभी मतलब एटलीस्ट पहले के टाइम पे ऐसे होता था, बहुत सारे लोग मतलब गवर्नमेंट जॉब इजीली मिल भी जाते थे। अभी तो वो भी डिफिकल्ट है, तो यू हैव टू बी इन हद तक, तो हर महीने का चिक रहता है, फिर जॉब चेंज करो, फिर अगर ट्रैवल करना है तो बस से जाना है या कार से जाना है, कार से जाना है तो कार के लिए पैसे चाहिए वो सब तो मेरे को लगता है कि स्कूल डेज बेस्ट होता है। बहुत सारे हम मम्मी को डांट सकते हैं, पापा को बोल सकते हैं कि यार ये क्यों नहीं किया, वो क्यों नहीं किया। यहाँ पे किसी को कोई कुछ नहीं बोल सकता, खुद भी सारे प्रॉब्लम्स होते हैं
So
मैम
yeah.
और से कौन से सारे मतलब स्टूडेंट्स हैं?
अभी हमारे पास में 12th क्लास के स्टूडेंट्स ज़्यादा होंगे, and I have sent the invite to other classes also, but I don't think, because half yearly exams are going to start, so maybe, but 11th and 12th classes of my art section, they will definitely join. It may take little time, so let us start. In between they will join,
Yes, ma'am.
right?
Absolutely.
So I would like to give your introduction, Aditi. My dear children, today I have a pleasure to introduce my dear darling Aditi. Uh, when you left the school, I entered the school. 2009 you left, and 2009 I entered the school. So I didn't meet you, but yes, a lot of praise I have heard.
Actually, it is mother.
He children were there. They were very so. Uh,
or whatever that you want to do in life. And that kind of makes it worse. So it's important for all of us to realize that we need to take a break every time that we're doing it. Try to make sure that you have a routine, that you get up after 20, 30 minutes and just take a walk, see what others are doing, see what is going on outside in the window. That will be helpful. Another problem that we have is acne. A lot of girls and guys, both of us have them. I guess it starts around the time when we become adolescents. One of the best things that you can do is just make sure that you exercise, because acne is basically when your sweat glands become clogged, and when that happens, you kind of end up with a lot of, inflammatory markers. You're also having changes in hormones that also causes it. It goes away with age, but in general, the good tips would be to exercise and to wash your face very often. You have these other things that you can use. You can definitely use antibiotics. You can use retinoids. A lot of people do that these days, but it's better to avoid them because everything has its side effects. The other thing you can do is a lot of water. Hydration is great. Try to have at least like 3 to 4 liters of water, or 6 if you're like at a good place. And make sure that we're just keeping exercise schedule pretty, sorted out. Another thing that you should do is never break them, never poke them, never kind of put random stuff on it. Use whatever ghar ka multani mitti or besan or whatever, but try not to use them, because then it will just end up with a bigger scar. Then we're going to mouth. So we've covered the face area. We're going to mouth. Before I end on the face area, I just want to cover. So this is like the T section of your face. And this is a very important section, because if you have anything here which is not fine, you kind of end up with diseases that can go up, that can go down, that can go into your brain, up into your brain, and then down into your gut and all. So this section should always be clean in general. Coming to your food. I guess food hygiene is very important in our houses. Sometimes we have food which is sitting there, we don't heat it up. We eat it just like that with milk. Sometimes washing dishes become an issue. For all the guys and girls, make sure that you help your mom to wash dishes and to clean them up, and to always make sure that you have clean dishes when you eat. Wash your hands. Make sure all the food is stored at proper place. Reheat everything if you can, and only eat hot food if you can, rather than cold. Hot water, hot food, because that kind of like, even when you're washing dishes, when you see if you put hot water, it gets cleansed out very nicely. Similarly, when you have gastritis and other issues, it's always better to start off with a little bit warmer stuff rather than cold, because it just makes sure that everything gets out of your body pretty fast. We'll then talk about dental issues. I think this is very important in us, in kids. What ends up happening is all our teeth have got an enamel, which is the outer layer, and then you have the roots, you have it's the tooth structure is there. The enamel is something that it's one of the most strongest substances in the body, but if it gets eroded once, it does not grow back. And what basically erodes is sugary foods, sugary drinks, acid. So when you're having a lot of food, when you're not exercising, your esophagus, which goes down, does not like it. So it gets irritated, and it makes sure that all the food comes back up. So you get this little acid reflux. And that is very acidic. Like the pH of the stomach is very low. So when that goes and hits your teeth, it kind of rubs all that out. And then you end up with cavities, and sometimes you end up with a root canal, which is super painful. So what I would recommend is make sure that you brush your teeth every time, at least twice a day. Rinse your mouth after brushing. And one thing that I learned, like in general, is try to floss if you can. If you can, it's always good to floss. When you go into the gums and you clean out everything there as well. But this is, dental hygiene is very important in general, to make sure that you also don't end up with other complications. Like if you have an abscess, like you see in this picture, there's an abscess. Sometimes that abscess has got direct connections with arteries and veins inside. And when that happens, it can even go into the heart. Sometimes that infection, it can go somewhere else. So it's always better to have good, nice teeth. Drink a lot of milk and have calcium. I'm going to add that. Now we come to chest. There are more topics I'm going to discuss in chest, but one of the main things we can talk about is definitely COVID, like we did initially. I think there was an entire topic on COVID, so I'm not going to go into more detail about it, but just know that it is pretty much a deadly disease. It's spreading everywhere. Try to wear masks. Masks are supposed to be worn above your nose. Cover as much as you can, as far as you can. Don't cough into somebody's face. directly. Always cover your mouth with a cloth or a tissue, and then you do the vampire cough where you do like this and then cough into your elbows so that that doesn't go with your hands to anyone else or in general into faces. One of the other things I wanted to discuss about chest was respiratory diseases. I think right now the third most deadliest disease in India is respiratory disease, if I'm not wrong. Correct me if I'm wrong. Um, which means that lower respiratory diseases are so common in India. We are the leading cause of, like, we are the leading um, country with TB in the entire world. And we are among the three main countries which have got multi drug resistant TB, which means that our country basically has got a lot of people who don't practice good respiratory hygiene. And that is exactly what it means. Soften the cloth, make sure that you're wearing a mask, don't remove it when you're talking to people. I know it is really uncomfortable initially, but you have to kind of get used to it. COVID is not going anywhere for a while at least. There must be something else that is waiting to come up in general. Vaccinations will be difficult. So make sure that you're practicing good respiratory hygiene, especially when you're around people in crowded places. Try to avoid, first of all, going to them, and if you're there, then try to definitely make sure that you're having mask always, washing your hands often, and not getting too, don't stay there for too long because the outcomes of that are pretty devastating. We go to the next part, we go to abdomen. So again, food poisoning is very common in India. Like I said, we have a lot of diarrhea, we have a lot of food issues. One of the main things is sometimes we probably are, we have a lot of variety in our food in general as well. So we have a lot of spicy food, we have a lot of sweet food, we have salty food. That sometimes doesn't bode well with our stomach. Whenever you have chills, heartburn, nausea, dizziness, or just heat in general in your body, you know that you're going through something. In that case, make sure that you're having probiotics, which is dahi in general. Make sure that you're having hot water. Go always on more fluids rather than solids in such situations. But majorly to prevent it and to be hygienic is again only two things. Wash your hands, keep the area clean, practice food hygiene. Like I think these are main things that you need to do to make sure that you don't fall sick after you know have food and avoid बाहर का खाना ज़्यादा घर का खाना अच्छा होता है. Also nowadays I think this is pertinent whenever you go and try to eat outside. I don't know if things are opening up and how much they're opening up back home, but if you can, just see whether you really need to go out and eat or can eat indoors. If you have to go, make sure that you know what is the COVID-19 situation in your specific area. How bad is it? Everybody wants to work. Everybody wants, like, closing restaurants and all is a big deal, but at the same time, it should be done in a way where it is safe for everyone who's coming in. So make sure that the restaurant is following pandemic rules in general, and ask yourself, do you really need to eat outside right now? Or ask or order from outside even. The other thing I want to discuss, which is, I guess, very important, I feel, in our generation and making sure that we all are knowing about it, is menstrual hygiene. And this is equally important for guys as well as girls. All of us have got mothers, sisters, friends who are female, and most of them will end up with this situation where they'll be menstruating. And it's important that everybody realizes that and is sensitive about it. So one of the things that is what we found was about 8 on 10 women or girls did not know what menstruation is until they had their first period. It means they did not have good education and awareness about it. Now, some of them thinking they were dying. And there is a book or even a Netflix, I guess, and with an E, you see that. The really old one in 1970s. And they had the same situation where girls who have a menstruation would be thinking that they're dying. We are in 2020, we're still having the same situation. It's not a good sign in general. And so I wanted to bring this up definitely in this talk. The other thing is access to pads, access to any kind of tampons or whatever that girls are using basically is important. And finally, 1 in 3 girls miss their schools because they're going through their periods, which again is something that probably we can work on. So now coming to what menstruation is, first of all, it's very natural. It's a bodily function. It's when your body starts changing and you have these hormones which are released and in more quantity. It basically is a bleeding from the uterus that occurs through the vagina. It occurs every month between 2 days and 7 days. This is the menstrual cycle. I'm going to explain it in brief. Basically, you have a normal, you don't have any bleeding for about 20, 25 days. And then there is the phases start changing. I don't know what age group everyone is, but we start with menstruation, which is when you start bleeding for 3 to 7 days. The endometrial lining bleeds. Basically, the egg is released and it makes the endometrium ready for conception, which means it makes it ready for a baby to be sitting there. However, that doesn't happen. And when that doesn't happen, then bears fall. That's exactly what menstruation is. So it takes about 5 days, and then you have the next phase of cycle, which starts, the ovaries start growing up, they enlarge in size, then the follicle is released, it goes down towards the fallopian tube, and then it again makes the bed, which is in the luteal phase. You're going to start and it's like, okay, we don't have any sperm coming in, so we're going to shed the bed that we have made. And this cycle goes on. And it goes on for quite some time. For some girls, it starts around 9, and then it keeps going for about 50s, sometimes in the 50s. So all guys and girls should be super aware that their mothers and sisters are going through some pain, some cramping, some headache, some mood swings. So please be sensitive around them. That is just something. And try to help them out when they're going through that. Okay, it's okay to talk about it. It's okay to know about it. And there is nothing weird about it. It happens to everyone. I just want it clear. So we talk about it. Coming to how you can keep yourself clean during these periods, make sure that you're using like you use unused cloth, you use clean stuff. Make sure you always clean, and this is for both guys and girls. Always clean from front to back, never the opposite way. So there's any more pathway into your genital tract instead of your anal tract. Coming to washing, make sure you're always clean, wear clean undergarments, and make sure that you wash your area very well. Coming to disposal, this sometimes becomes an issue everywhere that I have seen. Make sure that you wrap it in a paper, keep it clean, put it in exact places, don't flush it down. Because again, if you're flushing it down, you're making sure that the pot is becoming more infected with blood. Blood is a great culture media. All the bacteria will grow in there. It'll make it worse. It'll spread more bacteria. So try to keep that place very clean and make sure that you deposit it in a proper place. You can do other things. You can burn it, incinerate it, but we don't do it anymore. And during your periods, like I said, make sure that all the women in the family are basically happy, eating well, and they're staying clean and hygienic. The next topic is more for guys as well as girls. This is the anatomy of a guy's genital urinary tract. You can see that there is a urethra, there is prostate, there is bladder, there are ureters, and then they go into kidneys. Now, because urine is such a good culture media, if there is anything that is sitting there, if you're not having clean undergarments and stuff like that, sometimes the bacteria can go up. It goes and it sits, and the urethra goes all the way to the bladder. It can even go to the ureters. Sometimes cause very devastating kidney problems. So these things should be definitely noted in all adolescents. Just because there's so much change going on, sometimes it becomes really difficult for us to keep a track of these things. For girls, it is more common because we have like a smaller urethra, so that kind of makes it easier for bacteria to sit there and to get accumulated. But important prevention, again, keep the area very clean. Make sure that you bathe every day. Keep it very dry. All your folds should be very dry. From the neck down to your groin area should be dry. Some people use powder, some don't. But in any case, just keep it dry. That's most important. Then we go towards sexual health. I wasn't sure what is the age group that we are kind of targeting here. But in general, it's a topic which is not much touched in our society very often, especially early on. But I think it is important to know that one and the most important thing is everybody changes. You do have, like, growing up, you do feel like, somebody is more important to you, and you start like crossing some lines that you want to. But in general, try to make sure whatever you're doing, be safe. Know your safe practices. I'm not going to discuss them more in detail, but if you want, I could. I'm definitely open to that. So I'm just leaving it up to you guys. But make sure that you're always safe. Make sure that you are not forcing yourself. Consent is very important. Saying no is important, and accepting a yes is also like equally important. So know when it is exactly no. If somebody is not ready for something, do not force them. Do not like get into something which you're not ready for, because it can have a lot of complications later. There have been cases where kids end up having bad experiences. They get pregnant and they have other issues. It's kind of like I said, you're an adolescent, you're going to be an adult. It's going to make an entirely new trajectory in your life, which you would not want to have. It's an experience that you would definitely not want to have if you're not ready for it. So, what I would recommend right now is your kids, be kids, focus on your studies, focus on making a great name and making a great career and in general life for yourself. With COVID and with all these diseases, it's going to become very difficult and it's going to become even more competitive in life to have a good holding. So it's always better to be more prepared in general early on. So you can have all the fun that you want, but just be careful is all I'm trying to say. The other topic is sexually transmitted diseases. These are very important because once you get them, it becomes slightly difficult to get rid of them. You can start off with the big ones like HIV, gonorrhea. These HIV specifically, even though we say that we have a treatment, it's a very long-term treatment. You have to make sure that you're on top of things. It's very difficult to sometimes manage it. It's deadly as well. So it's a very big, and being safe, making sure you're wearing condoms, making sure you're clean is very important. To other diseases, gonorrhea and syphilis and herpes and all those, they are also pretty common. They have treatments, however, they are again affecting your genital area, which is not something that you want to have. So we can discuss it more. You guys can reach out to me, or I can talk more about it, however you want to do it. When we talk about substance abuse, again, this is a very new time in your life. You're going to have friends who are going to try things. Somebody must be having someone who they know already doing these things. They have already tried it. They will offer you to try it, and the peer pressure kind of goes on. Or you would just want to try it just because it's something new and cool. However, smoking is a very, I would say it's a slow killer. You start off with it, it affects every organ of your body. It does not allow any healing to happen. So say you have smoked for about a week or something and you get hurt. I won't say week, but if you smoke and you get hurt, even if you get a small cut, a person who's non-smoking will be healing very fast. It affects at that level. It goes, the nicotine particles go and sit in your skin and they go and affect it. I guess people are even trying weed. Weed again has got many complications with people. I guess I'm not discussing just because people are not taking them too much. But it also has a lot of complications, not healthy, and I would not advise anybody to go for it. Alcohol, on the other end, is again a pretty devastating killer. It can destroy your liver. It can make sure that like for guys, the estrogen level increases. They have more hair loss. They have thyroid gland, which increases in size. Basically, your entire body changes with these substances. If you go even on worse substances, that can cause pretty devastating and pretty, I think the families get more affected because of these things. So try not to go down that path. If you truly, I'm telling you, try not to go down that path. It will just lead to a lot of problems in your life. Medically, people who smoke, especially early on, drink early on, apart from lungs, like everybody tells you, every organ of the body, including your sperm, including your ovarian function, including your GI function, gastrointestinal function, everything gets affected. So though they look like they're simple, but you are what you eat. So if you take these things in your body, they're just going to not bode well with you in general. So try to avoid them, even if you have the temptation or you have people who are doing it and they're fine. Just try to avoid these things. Again, I'm sorry, I'm flipping back because I guess a slide which came in later, the urinary tract infection slide. I'm just going to discuss it just because it's there. You can have urgency, frequency, you can have bad smell, you can have pelvic pain. Again, like I said about sexually transmitted diseases, and then you have UTIs. The way to get rid of them is again wipe front to back, drink a lot of water. There can be tests you can do, the days are pretty late. You don't need to do them early on. And then make sure that you're always clean in general. Into the last part, I guess, which is foot. So foot and nails are very important. If you see older adults in your family, when you're sitting down, sometimes just observe people's feet and see how their nails are. People who age will have really brittle nails sometimes. Their sole of their legs will be kind of scraped off. Most of it is also the kind of foods that they use, but in general, it depends upon what kind of food care they're making, that they're doing. So some of the ways that you can take care of yourself is make sure that you trim your toenails every time. Don't go into the beds of the toenails, the nails, because that will just push it inside. Don't bite them, because again, that's not healthy. Make sure that your toes specifically, if they have any infection, try to see if you can catch it early. There are ointments that you can use, and you can get them from some, practitioner who can provide them to you. But there are ointments that you can use and that can heal these fungal infections that basically start off at later ages. Rub your feet really nicely, put a lot of lotion, keep them nice and clean. Um, Coming to environmental health, I think it's very important for all of us to understand that, especially this COVID has explained to you that if one person has a disease, he has the capacity to spread it to a lot of people. So we are just not human beings individually. We are a part of a society. We are a part of a world, and we are global citizens. So we have to make sure that wherever we are, we don't uh, we keep a clean one, and we don't make it worse than what it already is. So this is a very good. Like, I was looking at what I can show as an example. I think this is a very good example, which shows that if one person throws garbage, the other person will throw it right there because there's already garbage. Instead of picking it up, the third person will add on to it. So it will become like a pile. It will have flies on it, and then people will say, this place is so dirty just because of the people in it. So in general, try to make sure that you're the person who at least will better a place rather than making it worse. In school as well, at your home as well, if something is broken, something is not working, nobody is going to do it unless you put your hand up and you put your foot down and you're like, you know what, I'm going to do this. So make calls, make sure you reach out to the right people, ask them why something is not clean, why something is broken. We find out who's doing it and then fix it. Try to be a fixer rather than a spoiler. Um, Finally, I want to talk about mental health. I was going through some stuff and I found that in the US right now, 79% of adolescents are not receiving appropriate mental health care. And US is a very, pro mental health place that I have seen. I don't know how much it will be in India if we truly do a number. I think it definitely will be way higher. So again, our problems are different from here, like in general. But to just put a point to it, you're at a stage in your life where I'm sure all of you are having some of the other family problems, some of the other friend problems. You're having problems with studies. I'm sure the 12th standard people are not sure what is going on with the exams and all, especially with COVID in classes. In your career, you're going to be having a lot of questions. Not only about people are going to ask you, all people who visit you or talk to you on Zoom, and everybody will be like, "What do you want to be when you grow up?" questions. So yeah, and there'll be some people who will be doing extremely amazing. Some will be kind of struggling. Some will be just in the middle. But just know you have a very long way to go. Whatever that is going on in your life, you're still very young. You have a very long way. All the problems that I used to think were huge and will destroy me, like my board exams, if I didn't do well, I used to feel like, oh my God, it will be such a big problem and stuff like that. And then it wasn't as bad as I thought. So even in your family, whatever is going on, it's not as bad as you think, and you will grow out of it. Everything that is going on will pass, and you all will get through it with really, really good life. So I hope that you realize that. And finally, I just want to end with one thing. Whatever that you want to do in your life, just know you can achieve it. Make sure that you know in your heart and mind that if you have a goal, try to first make any goal, however small it is, but try to have a goal and know that you can definitely achieve it. It will be difficult, it will be sometimes painful, but it will be something that you will truly enjoy. To give you examples, like adolescents at our age, who are younger than 19, who started doing great things, included Bill Gates, included Jobs, included Steve Jobs, included so many great people who have done, like Vivekananda, so many people who did so much before they were even, 19, 20, 25 years old. Because what the society does to you is make sure that you pass school, you finish your 12th standard, and then you grow out of it, and then you will kind of achieve your dream. But the truth is, nothing changes. You are just left alone at the end of 12th standard or even before that. But you have to kind of start thinking about early on that what do you want to do with your life in general and start trying to achieve it. If you want to, I don't know, like if you want to be an engineer, an architect or whatever, just try to talk to somebody who's in that field and be like, can I visit your, can I see what you're doing online? Can I see your project? Go online, try to find out what is doing. And you can do that. Like a lot of kids nowadays are coding and they're making their own stuff. That's exactly the point that is being made. That we are taught that we have to study and be in school. I'm not saying leave school. I'm definitely not saying that because that's not going to help you at all. But try to make sure that you focus all your energy into something that is very constructive. And nothing in the world is unachievable. Try to go and do all the things that you want to do. I think that's it. Small things are everyday bath, wash, brush your teeth, clean spaces. And that's it. That's all I have to do. Thank you.
Thank you very much, Aditi. It was
And please feel free to ask any questions.
a wonderful session. It's open to the children, those who are
I
there
think,
on
ma'am,
the
you're
platform.
muted. Let me just unmute you.
Yes, Aditi, it was a wonderful session, and you have covered everything related to adolescents, the human body, different systems they work, and how they have to keep them clean, how have to maintain they have to maintain the hygiene. You have touched the girls problems, the girls hygiene, the boys hygiene, the sexual problems, or everything you have covered, mental health, whatnot. So children, those who are on the platform, if they have any questions, they can ask Dr. Aditi. You will not get this kind of chance anywhere. So this is a wonderful platform, and Aditi has created such an aura that it's something very good that you are getting. Please, if you have any questions, please ask directly to Dr. Aditi.
Yeah, and you can if you're
Yes,
if there
ma'am.
Yeah, go ahead.
Yes, ma'am. I'm Khushi. I wanted to ask a question. Like, lately I've been very lazy, and like there is no concentration and all. So, is it like normal, or is just my laziness that I don't want to work? Like,
Okay, I'm
you
gonna
know,
ask you one, how old are you? And second is how lately is lately?
sorry.
How old are you? Sorry, if you don't mind me asking.
I'm 17, and like it's been a month now that I feel way more lazy. Like I can't describe how lazy I am.
I think the time is pretty lazy. Like I'm usually working, so I don't find the difference. But whoever I've spoken to has said that it's I guess very slow right now because of COVID, because of being at home the whole time. You don't have a timetable. Nobody's making a timetable and then ringing the bell every 30-40 minutes. Ki baba chalo, next class chalu ho gaya hai. So that is not happening in general. So I understand. You're at home. I can't see what you're doing right now. You must be on the bed. So it's pretty like. It's a very strange time right now, so I understand that it might feel like you're slow, but I would, especially, you would be right now giving your 12th exams if I'm not wrong, correct?
Yes.
Yeah, so I would definitely encourage that try to make sure, look at the goal that you're having. I don't know what you want to pursue in your life, but whatever it is, sadly, but very honestly, marks are very important in any field that you go into these days. Just because there's so much competition, they need a way to sieve people out. They need to find a way to do that, and the best way to do it is examination. So your scores are very important, and just know that if you truly want to be independent in life, if you want to achieve things, if you want to be happy, and if you want to have control over what's going on around you without people telling you what to do, I would definitely recommend looking at that end goal that, okay, you want to be on your own, happy, independent, and then think about every day, thoda thoda karke, try to start reading. Make a timetable. I think that will help you a little bit. And tell somebody who's like responsible in your family or your friends to just remind you every time that this is supposed to happen. There is a Pomodoro technique that basically people do. They do the 20-minute thing that they put 20 minutes of work time, minutes of chill time, 25 minutes of work time, and 5 minutes of chill time. And that kind of works for many people. So try that if you can. It's called Pomodoro.
Okay. Thank you.
Any other
I
question?
hope it was helpful. Yeah, go ahead. Do you have another question?
Any other question?
If you have any questions that you want to ask personally as well, you can send me chat messages. I'm okay with that as well.
Yes. If you're not able to ask, if you have any uh, hitch, you can write in the chat box, or you can join live and write the question. Children, anyone? If you do not have the question, we will sum up.
All right. And I'm going to give you guys my email address, and please feel free to reach out whenever that you need to, at whatever reason, for whatever reason. Any career questions in general, whatever questions you have, please feel free to reach out.
Okay, Aditi. Ultimately, we come to an end. I visualize a small Aditi who used to come to the school and now is such a big Aditi, a big name. Dr. Aditi is a surgeon. Oh, I think a dream come true. Uh, I have no words to express myself, Aditi, because when our children do so well, it is beyond beyond expression. You really feel
No, it is.
that the child is doing. You're still a child for me, and you are a motivating force for these children. Those who have come on the platform, they are all from 12th standard. तो इनको ये एक मोटिवेशन मिलेगा ज़रूर कि यस, एक छोटी सी आदिति इतनी बड़ी डॉक्टर बन सकती है, इतनी बड़ी सर्जन बन सकती है, तो कभी क्यों नहीं हमारा भी एक सपना पूरा हो सकता है. हमने अगर कुछ देखा है, कुछ बनने के लिए सोचा है, बट उस सपने को पूरा करने के लिए उतनी ही शिद्दत के साथ, उतनी ही लगन के साथ उस सपने को पूरा करने के लिए लगना पड़ता है. And nothing is impossible in the world. Everything is possible, and impossible word is having possibilities. I am possible, it says I'm possible, so everything is possible. Aditi, no words at all. बच्चे जब अपने बच्चे जब कहीं पर प्लेस होकर के और एक पर्सनालिटी होकर सामने आते हैं, वो आज एक सपना जैसे कि पूरा होता है ना. यू आर ऑन द प्लेटफॉर्म. वो एक छोटा सा बच्चा और कितना बड़ा उसका नाम. It is wonderful, and I dream the same thing for these children, those who are on the platform. एक छोटा सा बीज ही तो होता है जो बहुत बड़ा एक वट वृक्ष बनता है और कितने लोगों को छाया देता है. तो now Aditi is giving a lot of motivation to these children. You are a real motivation to every one of them, and I believe with this motivation now they will start working very hard. And Aditi, I believe you will tell them that yes, there is no shortcut to success. How much you have worked hard, you just tell them. This is my request to you, that tell them that the hard work always gets the results, not the easy way.
I think that is very true because it sounds very nice. If you ask any of my friends, they would know how much how difficult it was even to do medicine, to come out of it, to try to come to another country, a new country. And it's very, it's a different experience altogether to come here, to try to get in somewhere, keep trying. So I went to 3-4 places before that, before coming to Emory in general. It's a long, I would say, journey for me. It hasn't been at all. Some days were truly frustrating, I would say.
I know.
It's still not easy. I mean, it's still not easy. Like I said, being a kid is very easy. People are there to support you. People, even though you feel like they're not truly there sometimes, like your parents and all, you feel that it's वगैरह. But actually, they're doing so much for you. But when you're truly alone, it becomes very difficult to kind of understand their value. So if you can, everything I am today is because of everything that my teachers have taught me. I had Leela Devi ma'am, who was my maths teacher. I don't know if anybody can find her, I'll be super, super grateful to them. She was so amazing for our entire class. She basically made sure that at least out of 40 of us, at least 30 of us got more than 95%, if I'm not wrong, in 10th standard. And that was like a huge number in those days. I don't know how it is these days, but it was a huge number. Nobody would do that at that time. And then we had like, my English teacher was Nafisa ma'am, it was Varghese ma'am, it was Reenie Thomas ma'am, the Lalsa. These all people have been super improved. Like right now, whatever English I have, it's not very different from the one people speak here, just because I had a very good foundation with all of them. I did my essays. I used to be sometimes not good at them, sometimes I used to be good, but you try. Try to make sure all of you take initiative wherever you can in your lives. If somebody's saying, is anybody interested in doing this? You have to put your hand up and say that yes, even though you're going to not do well, just put your hand up, try the experience. It's okay if you don't do well at it. But always try to make sure that you are at least standing up and taking initiative to do something good in your life. And then bio, I guess, there was Lovely Joy ma'am. There were a lot of people for bio, I guess, overall. But Lovely Joy ma'am was our class teacher in 12th standard. And she was super amazing. And the principal ma'am, everybody was really nice to all of us. So in general, what I'm trying to say is your teachers are truly your strength. They want you to grow. They have invested their own lives to make sure that others grow. So make sure that you are doing the respect. You're giving them respect as well by listening to them sometimes. Just try to listen to them and see how it works. Never know. So yeah.
Yes.
That's my thing. Like,
yes, Aditi.
Teachers and your parents really support.
Yes. Thank you very much, Aditi, that you shared your personal experiences and you told them that there is no shortcut to success, and how much a person struggles, and still the whole life you have to struggle. And now this is struggle where you are feeling that support is not there. Earlier the support was there when you are in 12th class, when you are in 11th class, parents are there all the times. They are caring for your lunch and dinner, they are caring for your health, they are caring for what you are going to wear, they are caring for your choices. They care everywhere they are there. Is in the school, your teachers are there, you have got a lot of support. But when an individual steps in the practical life, actually nobody is there. You have to decide your own destiny, you have to take your own decisions, and your decisions either the wrong or the right. If the wrong decisions are there, you have to suffer. If the right decisions are there, you will enjoy the life. So life is like that. This you need to understand, children. And Aditi has been wonderful to share her experiences. I'm very much thankful to you. You were very true to tell them that this is the way how you have reached to this level, and it is not an easy journey for anyone, any field and anyone. So thank you very much, Aditi, giving this much of time, even though you had off, but you must have planned to take a little rest. But this was the correct time to motivate my children, and it was not only an health and hygiene for them, it was a motivational talk. And yes, I would like to have you once again later on if you have any time. Wonderful to talk to you, to have you on the platform.
Yeah.
Thank you very much, Aditi. Thank you.
Thank you
So
so
nice
much, ma'am.
of you.
Thank
you. Bye. Good night.
Bye.
For me, good night, and for you, good day.
Thank you guys. Thank you so much for listening.
Okay. Thank you, beta.
Yeah.